Waleed, are you there? Okay.
Yes, we can start now.
Okay. Hi, good morning, everyone, and good evening, everyone who is in Pakistan. My name is Dr. Sadiq Naveed. I'm Associate Professor of Psychiatry at University of Connecticut, I'm a lead psychiatrist for child and adolescent inpatient units at Hartford Hospital Institute of Living. I'm also chair of APPNA Merit Research Committee and also chair of APPNA Young Physicians Committee. Today, we are here to talk about a really important topic, how to improve the quality of research publications and journals in Pakistan. And I'm honored to introduce our guest speaker today and panelists today. Our guest speaker is Dr. Farooq Azim Rathore. Dr. Farooq is a consultant associate professor in rehabilitation medicine at Armed Forces Institute of Rehabilitation Medicine, Rawalpindi. He describes himself as a teacher, researcher, and mentor. He is passionate about teaching writing skills and has conducted more than 100 workshops on medical writing, scientific misconduct, research ethics, presentation skills, spasticity management, and stroke rehabilitation in 5 countries of the world. His areas of research are spinal cord injuries, stroke rehabilitation, amputee management, disaster rehabilitation, medical education, and bioethics. Welcome, Dr. Rathore. I will also like to introduce our panelists as we are getting this chance. Dr. Professor Asad Aslam Khan, he has been recognized with Sitara Imtiaz by Government of Pakistan. He's serving as Director General Administrator for Punjab Human Organ Transplant Authority. He is Professor Emeritus Professor. He also serves as COVID coordinator for Punjab. He's also a member of WHO monitoring team for Vision 2020. So I would like to hand over mic to Dr. Rathore, but before we go there, I will also like to introduce and recognize Dr. Shahid Rafiq, who has been an integral part of leadership of APPNA Merit Committee. Thank you, Dr. Shahid Rafiq, for being here. Mic is yours, Dr. Rathore, when you are ready.
Thank you, Dr. Naveed, for the introduction, and thank you, APPNA, for the opportunity. Just let me share my screen. Okay, so can my participants please confirm that they can hear my voice and see my screen, the first slide, how to improve the quality of research, publication, and journals in Pakistan? A simple yes in the chat box would be sufficient.
Yes, someone answered.
Okay, yes, okay, I'll start off. So before I formally start, a little bit of a disclaimer and a couple of acknowledgements. First of all, this presentation, which is on a very important topic, is primarily based on my own personal experience and interaction. My journey of research and writing, like many others in Pakistan, a developing country, started off without any formal institutional support. So I started off, I published my first article as a 3rd-year resident back in year 2017. That was more than 15 years back. Over the years, I had a chance to collaborate with many people all around the world. And alhamdulillah, so far, I have multiple publications with multiple authors all around the globe, including Northern America, Europe, Australia, Japan, China, and obviously Pakistan, India, Bangladesh, and other developing countries as well. So I have a little bit of idea how this research culture works in the developing world, particularly in Pakistan. What are the challenges being faced once you are a young resident or an undergraduate student? And what challenges would you face once you start publishing in national and international biomedical journals as a young and then maybe as a mid-career faculty? And one important thing that I would like to disclose that, this is going to be sort of a bilingual presentation. So primarily my mode of presentation is going to be English, but कुछ बातें आप उर्दू में करनी पड़ती हैं क्योंकि कुछ बातें आप उस तरह बयान नहीं कर पाते किसी और ज़बान में जैसा उर्दू में बयान कर पाते हो. Secondly, I would like to acknowledge my colleagues in Pakistan Association of Medical Editors, the PAMI. So we have a very active WhatsApp group. A couple of days back, I sent them an online questionnaire. I'm really grateful that within 24 hours, I received 30 responses. And most of the responses were from senior hierarchy and leadership. They were editors, sub-editors, associate editors, and editorial board members. And I have incorporated their wonderful insights into this presentation as well. So before we start off, we need to understand the past, present, and the future perspective in medical research and writing and journal publication. So I would like to take you back in history. When Pakistan came into being in 1947, around 7 years back, there were only 2 medical colleges, King Edward in Lahore and Dow Medical College in Karachi, with an approximate enrollment of 500 medical students. That was all. We did not have even a single medical journal being published from Pakistan, and we did not have even a single of our own indigenous residency program in Pakistan at that time when we came into being. Alhamdulillah, over the last 78 years, as of 2022, we have 184 medical and dental colleges registered with Pakistan Medical Commission all around Pakistan. There are 99 medical journals, biomedical journals, which are listed in PakMedinet, the largest local medical database of Pakistan. And there are more than 306,000 registered doctor and dentists with Pakistan Medical Council. So I would say, alhamdulillah, this is an achievement. And especially I would like to say today, because we are living in a time where everyone talks of despair, where everyone talks, lut gaye, mar gaye, kharab ho gaye. I would still like to say, we started our journey from nothing. और हमने बहुत कुछ achieve कर लिया है. There are always light at the end of the tunnel, and the glass is always half full. It all depends कि आपका अपना perspective क्या है and what you can contribute to the system and to the country. So be positive and look forward. In addition to that, we have a lot of medical students studying in these 184 medical colleges. These thousands of students are curious, they are eager to learn, and they are tech savvy, which is a very important sort of skill that can be helpful in writing and publishing in national and international biomedical journals. In addition to that, we have thousands of residents enrolled in different programs all around the country. These residents are enthusiastic. And not all, but most of them are really hardworking. And yes, many of them, they want to excel in their professional lives. And this collaboration can actually lead to great results, both for the individuals, institutions, and ultimately for the country. I told you we did not even have a single residency program when Pakistan came into being. As of today, there are 78 accredited programs of fellowship with the College of Physician Surgeon Pakistan and around 22 membership programs. Around 100 programs in the country at present, only by CPSP. I am not counting the MD and the MS program run by different organizations and institutions and universities all around Pakistan. If we talk of the publication trends in Pakistan, again, this was a very important article that was published back in year 2013, around 9 years back. So Vikramasinghe, he and his colleagues, they conducted a pretty simple search. So what they did was they went online on PubMed or the Medline and Scopus, which is a very large database. And they tried to extract that which are the articles that are published or authored primarily by medical students. Not going to go in detail, but this is one of the most inspiring graphs that I always try to show to my student, to my young faculty member. In year 2013, in that global survey, you can see he mentions USA, United Kingdom, and Canada. He also mentions Iran. Out of the 220 countries in the world at that time, he actually mentions medical students from Pakistan who had a lot of contribution as medical researchers in the international biomedical literature. And rest of all the world has been categorized as the category other. So I tell you, there is still hope. The glass is half full and there is always light at the end of the tunnel. Most of these medical students of 2013 are now either young faculty member or young consultants or about to finish their training. So they're going to join this pool and actually improve the future for this country. Another historical perspective. So Schemago in 2012, they ran a forecasting exercise. So they do this exercise every 4 to 5 years, and they forecast that what would be the global output, what would be the regional output in terms of research, and what would be the output of countries in terms of research and writing and output, stuff like that. So back in 2012, they predicted that Pakistan, which is located in the Asiatic region, is going to have the second largest jump in the world apart from Malaysia. And Pakistan is hopefully going to go up 16 ranks from 43 to 27 in the world in the number of research articles being produced. This is not specific to biomedical research, but journal research culture of Pakistan. And this actually happened. So this was a very big news that broke in 2018. It was mentioned by Nature that Egypt and Pakistan in year 2013 had the highest rise in research output. It was something great. We celebrated this thing. And other positive indicator that we can see in the country in the last 20 years are now there are many annual research days, seminar and conferences specifically geared toward undergraduate medical student and resident who can first present their research and then publish it in local and international biomedical journals. There has been an increase in the number of Offices of Research Integrity, or what we call ORICs, and research departments in many medical universities and medical colleges and medical institutes all around Pakistan. And now we have students and residents specifically who have better skills, a better understanding, and a better passion for research and writing, even more than their teachers and supervisors. And as faculty members, as teacher, we have to acknowledge this, we have to support this attitude, and we have to sort of like guide these youngsters who have enthusiasm, time, and a will to work. And this collaboration is going to produce good results. And because of all these things now, there is a strong evidence which has been published in multiple articles that there's an increasing trend of conducting and publishing research both at the undergraduate, postgraduate, and faculty level. And that's why research is the new buzzword in Pakistan. You mention the word research, and whether the other person is a student, a resident, or a faculty, they sort of get excited. And they start saying, "Hum article likhenge, I'm going to be a published author." And whosoever sort of like manages to publish X number of articles, he or she is a class apart. This is what usually happens, at least in Pakistan. But I would like you to please zoom out and take a pause here. All that glitters is not gold. All that is published and being reported should be scrutinized. And we need to ask questions. So probably the first question that we need to ask is, so why do physician, resident, and student publish so much? Why there has been a massive increase in the number of publication? What is the quality of these publication? What is actually written in this publication? Are these publications ethically correct? Are they being retracted? Or are there any issues? And we are going to answer these questions. So students, usually they want to publish because they want to improve their portfolios, to increase their chances of residency and matches abroad. And that's fine. That's a very genuine sort of like thing to do. The residents, they have to do certain number of publication as a part of mandatory requirement of their training programs, sometime for CPSP and sometime for medical universities, MD and MS programs. And obviously, faculty members usually write because they have to attain a certain number of publication in order to fulfill the requirement for the next academic promotion. So these are the mostly reason for which people write articles. So those of you who have been attending my workshop, both online and offline, I would request they should not comment on this, but from my other colleagues and other attendees, can you please interpret this particular picture for me in the context of the presentation that I'm giving? What do you think this picture portrays? What is your interpretation of this picture? You can write it down in the chat box. I'll give you a minute and then we'll move on. So what is your interpretation of this picture? Rat race and nothing of quality as such. The rat race, okay. Even if you win, you still are rat. Perfect, fantastic. Authorship race, competition. Good, excellent. Anything else? Any other interpretation? You guys are pretty close. Different strategies to start a race. Pakistan politics, okay, sir, but we are not discussing politics today, so we'll refrain from that. Rat race. Okay, so thank you very much. Yes, I totally agree. So this is basically a rat race, and this is my interpretation. And please remember, in life, you have all the right to agree or disagree with the person or the presenter. So my interpretation is this is a rat race, and these are the important sort of like participants. These are the faculty and consultants, and these are the resident. जो हम उर्दू में कहते हैं उनकी बगल में उनके resident, and you can actually identify these residents from the smirk on their faces. And these are the student. And as you can see, these students are much bigger in size. They have more energies, and they are actually going to crush you if you don't have the required amount of knowledge and skills that you can transfer them as a part of your teaching program. And yes, this is a rat race to publish more and more. And unfortunately, this is my interpretation. These are our regulatory authorities. I will not name them. You all know them very well. So these are the authorities that are going to sort of like publish guidelines. No, not guidelines. They're sort of going to publish different letters. So this is the new criteria for promotion. Okay, that's fine. But have you actually seen the research culture in Pakistan? Do you have seen the support system of research in Pakistan? Do you see how we work in this over-constrained system? Do you know the challenges that we face on a daily basis? What is the support that you're offering? They're least concerned. They are going to issue regulations, do this and do that without realizing that, in order to achieve a goal, you have to equip the people. And unfortunately, a result of this rat race, people are involved in publishing more and more without giving any attention to the quality. And as one of my colleagues just mentioned, the trouble with this rat race is that even if you win, you're still a rat with a large number of articles which do not make any impact on the national or international scene. So please go back and look around, or even look at your own publication in the last 10 years. If in the last 10 years you have published 50 articles, 50 manuscripts, and you have not even gathered, let's say, 100 or 200 citations, I'm really sorry, your articles or manuscripts are not making any difference in patients' life. They are just run-of-the-mill articles which are being published for the sake of publication, but they are not making any impact on the biomedical scene. So I asked this question to my panel of experts of PAMI, Pakistan Association of Medical Editors. And my question was, in your opinion or experience, has the quality of medical research and writing improved in the last 2 decades? And as you can see, 3/4 of them actually said, yes, the quality has actually improved. But when I asked the question, do you have any concerns about the quality of medical research and publication from research being published in Pakistan? As you can see, majority of them had concerns. And I also share these concerns, and I'm going to sort of like narrate them for you. So the challenges, the first challenge that we face is actually little expertise and minimal funding to conduct medical research. You need to understand, if you want to publish good quality research, that is going to need a certain amount of training, a certain amount of dedicated time, and obviously funding. You cannot have good quality randomized controlled trial and good quality interventional studies if you do not invest in your researchers, in your clinicians, and in people who are involved in research. And this is a major issue being faced by researchers and clinicians in Pakistan. Then, being in Pakistan and working in this healthcare system where, at least in public sector hospital, sometimes even consultants have to see more than 100 patients in a single day. They actually start at 8 in the morning and they stop at 4 in the evening. And then they have to start with their own private practice in their own time. So how they're going to conduct and publish high quality research? So there's a shortage of time. There is no protected research time even for the residents who are enrolled in the CPSP and other MD programs. And there's no protected time for the research for the clinicians who have to wear multiple hats, right? And there's unfortunately a lack of institutional support. Just because out of 184 medical colleges, 10 or 20% medical colleges are offering support does not mean that other medical colleges are at par. So medical colleges, many medical colleges do not have well-equipped libraries. They do not give access to literature searching. They do not give access to plagiarism detection software. They do not have appropriate biostatistician available on board. And unfortunately, still they demand from their faculty and resident and students publish more and more so that our institution can grow. I'm sorry, it won't happen like that. And Nadia Agha wrote in one of the columns that she wrote in Dawn, this is a general comment on research, not specific to medical research, but at least it is very much applicable in medical research as well. And she says, apart from the coursework, the Pakistani institution offer no help to enhance a student's understanding of research and dissertation writing. So, and this is very, very true, that we simply perform 2 or 3 exercises, workshops, and that's it. Dr. Khushik says that research programs at most public university departments in Pakistan highly dubious and purely a mockery of research. And unfortunately, in the last 10-15 years, we have seen many cases of fabrication, plagiarism, and many high-ranking officials, even the rank of a rector, were caught doing plagiarism and other things. And the research that they published was labeled as dubious and of low quality. Unfortunately, nothing happened. And Dr. Fatma Jawad, editor-in-chief of JPMA, once mentioned that original biomedical research that meets the international standards is scarce in Pakistan. So these are the challenges that we face. And Anjum Altaf actually gave a very damning statement and very direct. He's one of the former provost of Habib University, Karachi. And he said, the quality of research in Pakistan was always poor and continues to be so. Can you cite any ideas emerging from Pakistani institutions that had global or even regional impact or recognition. So this could be one of the litmus tests for the research that you perform. If your research makes a difference in patients and people's life, if it makes a difference in healthcare policy, if it is being quoted and cited repeatedly, this means this is a high quality research, and the time you spent in writing that research paper in national or international biomedical literature was worth it. It will be cited, and it's going to be sort of a tool for changing lives. But if it's not like that, you need to reconsider your strategy. So these are the concerns about the quality of research in journals in Pakistan based on my own personal experience and my colleagues' experience. The first is, unfortunately, low quality single center observational study. Pick up any biomedical journal of Pakistan, indexed or non-indexed. Most of the articles that are published are of low quality. I'll tell you what do I mean by low quality. And they are single center observational studies. So this is the hierarchy of evidence-based medicine pyramid. And as both as clinician, as physician, as healthcare professionals, and as author and students, we need to aspire to write and read the highest form of evidence, which is meta-analysis and systematic reviews. But if you go and analyze the article being published in Pakistani Biomedical Journal, most of them are either non-randomized controlled trial or simple cohort studies, which means their quality is not as high as a randomized controlled trial or an interventional trial. Second concern is that of lack of originality. What we call a run-of-mill article or Me Too articles. So एक ही topic के ऊपर एक ही article को 10 दफा 10 institution लिखेंगे from 10 parts of the country. I'll give you one example. So a couple of years back, I wanted to do some research on epidemiology of stroke. And I was amazed to find that there are more than 30 articles on epidemiology of stroke. And most of those articles are single center study having around 100 to 200 sample size, and they are published from multiple areas of Pakistan. We don't even have a single large scale epidemiological data about stroke, neurological disabilities, and other issues. Small articles which do not make any impact because they're very regional and they do not give you the bigger picture. And then unfortunately, we have to admit this bitter reality. Most of the research is being done for the sake of promotion only, at least for the faculty. And let's be honest, it is documented in literature as well. So a survey was conducted in Karachi, 3 medical colleges, and I would say the faculty was very honest and upfront. 71% of the respondents admitted that they were not really interested in doing research, and they were only doing it for getting promotion. So if you make a culture where you are supposed and forced to do research somehow, where the end justifies the mean, you simply bring in some article by any mean. And neither your senior professor, head of department, your institutional head, or your committee, they're concerned, ye article kahan se aaya, kaise aaya, how this article was created, published, and what was the process, will it make any impact? So then you only get articles by any means possible. And that's why people do research. And peer review process for most of the medical journals is not up to the mark. So on the part of author, authors are crying, like our article take 8 to 12 months for the peer review. 8 to 12 months. You have to wait sometime for 1 year, and you have to request and send emails to the editor and the editorial office again and again. And not in every case, but I have faced this dilemma myself. In many cases, the editors even do not bother to respond. And you are flabbergasted, you are frustrated that what should I do? Unfortunately. And once you receive the peer review report, unfortunately, not in all, but in many cases, the peer review report is of very poor quality. And we know in some cases how the peer review is performed in Pakistan and many developing countries. So because, the head of department or professor saab ka bahut naam hai, he or she is the man in that subject. So he would get like 20 articles in 1 month for peer review. Obviously, he or she cannot do that. He's very busy. And he is going to send those articles or share those articles with junior faculty member or residents. So okay, please do the peer review for me. So how would you expect a resident to perform a good peer review if he or she has not been formally trained? And the result is a very poor quality peer review report, which often gets very late to the author. And then on a personal note, I think the major issue with Pakistani journals and Pakistani research and research in developing countries are the ethical concerns, the ethical issues. It doesn't matter how good you are in research methodology and biostatistics. if you are a manipulator, if you do not follow the principles of ethics, it does not matter at all how good you are. And the major concerns are, number one, coercive authorship. So supervisors, head of departments, routinely they force, they blackmail, and they ask their juniors, their faculty members, their youngsters, their residents, you write articles for me. You put my name as first author in every article that you will submit. And the other person cannot say no, because they are dependent and they are in a hierarchical structure. Unfortunately, it happens very commonly. If you want to close your eyes, that's fine. I know many personal examples. I know many institutional examples. Mutual support authorship, again, very common. Yaar, tu mera naam dal de, main tera naam dal deta hun. And people don't even think it's wrong. We are helping each other. This is not a lecture on bioethics, so I'm not going to go in detail. But let me tell you very clearly, as per all international guidelines, mutual support authorship and coercive authorship are categorized as unethical authorship. And if you are caught doing that, your article will be retracted and you can face consequences. Duplicate publication, again, pretty common still in Pakistan. In the last 3 years, I have myself, me and my team, we have picked up 3 duplicate publication. And at least one of them was already accepted for publication, but grateful to the editor that we highlighted it to the editor and she withdrew the publication. So again, very common. People write one article for one journal that gets published. They simply make small changes and send the same article to another non-indexed journal. And this is happening, unfortunately. Ghostwriting, gift authorship, you give authorship to your seniors, to your consultants and your HODs and stuff like that. Ghostwriting, I'm going to discuss in detail a little bit. Fabrication, falsification, jhuta data not being collected and data being manipulated. And unfortunately, it has risen to this level that people and some people involved in this business, they don't feel any shame in that. They know, the law, there's no law for that. And our regulatory authorities mostly are sleeping and they are not least bothered. So this is actually a service being offered from Pakistan on medical assignment writing. The person has given their email, they have given their WhatsApp number, they have given their mobile number. You can contact them and get the service. I'm not saying you should do that. It's totally unethical. And they're offering article writing and thesis writing service in cardiology, obs, endo, geriatrics, hematology. Look at this list. This is unethical. But if you need an article, you will get an article. Very unfortunate, and people are doing that. So this is also a major issue we are facing. Again, look at this Dr. Adrish. He is very confident, and one of the team member very proudly mentioned in this website that I have written 41 theses, obviously for others, fake theses. Again, this is unethical and it's a major concern. And this is something beyond this, so on Twitter, this gentleman who is a journalist in the news, he shared this. So people are actually advertising these kind of services openly in newspaper, and they have no issue in sharing their mobile numbers. HEC recognized journals category mein research paper kam waqt mein publish karaye. In English, it means HEC, Higher Education Commission of Pakistan, has certain categories, X, Y, W, X, and Y, high categories. So if you want to get an article published in these categories, please contact us. We'll take money from you, and somehow we are going to manage an article publication for you in these journals. Total unethical. And this is on Facebook. Add name in a paper approved by HEC, CPSP, PMDC, AJK, ABCDFG. And unfortunately, HEC, CPSP, PMC, and PMDC are least concerned that what people are doing and the quality of work they are producing just because they sent a regulatory letter a couple of years back. So this is something that we all need to stop and ponder. And this was something that came up a couple of months back. Again, so this is curious. It's a mega journal. It publishes thousands of articles. So they recently launched this curious wall of shame. Why I'm particularly focusing on this? Unfortunately, again, at one end in 2013, our medical students, they made a name for themselves by publishing good articles. And in 2022, many Pakistani institutions and researchers were named as one of the people who were involved in unethical behavior. And look at this person in the last, Raheel Barkat Saab. Raheel Barkat has 15 articles retracted. I'm pretty sure many of us have not even published 15 articles. And this gentleman has 15 articles retracted from curious because of data theft, fraudulent IRB approval, and he charged co-authors for authorship despite few or no contribution. So this is what is happening. And this is part of our research culture, very unfortunately. And one of the main reason is we do not have formal research ethic training in Pakistan. The education and training in bioethic and human research ethic are generally lacking, not universally taught as a separate subject either to undergraduates, postgraduates, and even to faculty member. Only few medical colleges and institutions are teaching research ethics as a separate subject. And please remember, clinical ethics that we face in our clinical practice is a bit different from human research ethics. These are two different things. You need to differentiate. And I'll give you a quick example of CPSP. So CPSP,
on the topic of suicide. So thank you, Dr. Murad Musa Khan, for being with us today. I really appreciate that.
Thank you for inviting me, Dr. Naveed. Glad to be here.
Thank you. Dr. Rathore, are you ready to
yeah, I'm back. Just give me a second.
Okay. So please ask any questions in QA section, and we'll be happy to talk about them. Thank you.
Apologies, and yep. Oops, this is not the one. Just
And Professor Rathore, time is right now 12:34. So,
oh yeah, I'll just take 10 minutes more. Just give me a second. Yeah, so apologies for this. Yeah. So again, can you please just give me a second. Yep. So again, can you please confirm if you can see my presentation? And yep.
Please say yes if you can see the presentation. Okay, yes, we can.
Okay, yes. So coming to the last part, how to improve the quality of research publication and journals in Pakistan. So first of all, is there any echo here or? Okay.
No echo.
Okay, thank you. So first of all, we need to understand the ecosystem of research publication in Pakistan or anywhere. So I feel there are 6 important stakeholders in this process: the authors, journal editors, peer reviewers, the readers, the journal health information consumers, and the regulatory authorities. And once we talk of how to improve the system, we need to understand a chain is only as strong as its weakest link. Each of these is very, very important. But if you again ask me, probably the most important missing link is training in research ethics. This should be the most important thing on which we need to focus as individuals, as teacher, supervisor, institutes, and regulatory authorities. So these are some of the suggestions for improvement based on my own personal experience and on my suggestion that I received from PAMI. Number 1, there should be mandatory research ethics training at all levels. We should start it at the undergraduate medical student and medical training levels for all healthcare professionals. And then it should continue to the postgraduate educational level, and refresher courses must be held both for faculty member and supervisors. And this training ideally should be sponsored and sort of like held by the institution. But in 21st century, every person is also responsible for their own self-learning and improvement. And I'm going to share certain resources as well. Number 2, we have to strengthen the research governance system in Pakistan. There is a lot of published evidence that says that most of the Institution Review Board and Ethic Review Committee of Pakistan are unfortunately what we call a rubber stamp committee. Most of the IRB and ERC only have physician involvement. They do not involve the nurses and non-paramedic and non-medical staff, including healthcare consumer and patients. So we need to strengthen our IRBs and ERCs and sort of make them function in an appropriate manner. We need to have a better training and support for authors. And this could be in form of courses and on the part of institution, access to literature. We need to understand that access to literature is very, very important, but sometimes very, very costly. You have to have solution for everyone. And this is going to improve not only the research culture, it is also going to improve the quality of clinical care in Pakistan, because it's going to be based on the principle of evidence-based medicine. Then you have to incentivize authorship. I'm not saying you start giving out money for that. Incentive could be in many forms, but unfortunately, apart from the faculty promotion, there are no other incentive for which a person should spend their own energies, time, finances, resources in order to publish high quality research. So again, depending on the institution, there must be some form of incentive for those who involved in high quality medical research and writing. Then a major issue that is being faced by Pakistani authors, and especially authors who are at the undergraduate medical student level or resident, is article processing charges. And I'm not only talking of international journals, which charge somewhere between $500 to $2,000, and many of them will only give you a waiver of 50%. And for a person in Pakistan, even like arranging $500 for an article is going to be a major challenge. I'm talking about Pakistani journals. Now, many good Pakistani journals are also charging somewhere between 20 to 40,000 for publication. And it sometimes becomes challenging for young residents and students. So we have to support these residents and students in form of some grant or some kind of scholarships. Then the editorial process and appointment system has to be improved. Again, in some cases, at least, which I know personally, especially when a new medical institution or a new medical college or a new medical university establishes a new medical journal. So, the senior most or the professor or all the professor of all the department, head of departments and the principal, they automatically become patron-in-chief, editor-in-chief, associate editor and stuff like that. So they sort of like hold all important position, but do not contribute. This process should be based on fair selection, on some kind of criteria. We should focus on people who have the required skills, whether they are youngsters or whether they are juniors. And once an editorial team is established, it must be provided appropriate technical, administrative, and financial support. Running a journal is not an easy job. It costs a lot of money. You have to provide them financial support, administrative support, and appropriate technical support. Then you have to sort of provide incentive and compensation. It is important. This is how the world works. So you are asking someone to sort of like do an extra job of running a whole journal, but you're not providing any incentives at all. So why would the person sort of leave the clinical practice and other thing and focus on the journal? You have to incentivize it and compensate them. Then the editor is also responsible. They have to ensure a robust and fair peer review process system. If some peer reviews are repeatedly late despite reminders, so despite the fact that they're very senior and expert in their field, you might want to look for other alternatives. Please do not waste the author's time for months on and months on. Then selection of articles. So recently we had a kind of discussion with a couple of my colleagues who are senior editors. So some of the randomized control trials that were being published in a particular category were of low quality. So again, I'm so grateful to my senior colleagues that they admitted that there was a oversight on their part, but we need to have a more robust editorial selection process. Then, editors must ensure that the author adhere to reporting guidelines. And this is sort of a global kind of trend that is coming up, that there are certain guidelines, and you can go online on Equator Network. More than 528 reporting guidelines are available. And any kind of article that you want to write, the reporting guideline is available here. Most of the international biomedical journals now, they demand that you have to download that guideline and you have to check all the tick boxes and then you have to submit that. So probably Pakistani editors can do this as well, and it will improve the quality of research publication in Pakistan. The institution, organization, regulatory bodies must clearly define the role of clinician, academician, and clinical researcher. हम सब confused हैं. am I a part of faculty? I am a part of the hospital. Should I do learning or teaching or research? We are not clear. It should be clarified. Then please promote quality and not quantity. Just because someone has published 100 articles does not mean anything if he or she does not have any impact. So instead of like number of article, go for the impact factor of journal, go for the number of citation that the person has gathered over the last 1 decade, and go for the all metrics as well, right? Alternative metrics. And then you have to support your faculty member by research grants and publication fees. Again, the article processing charges. And for authors and my colleagues who are listening to this webinar, please write and promote systematic reviews. For many of us, unfortunately, we will never get the kind of support that we will be able to conduct a large randomized control trial all around Pakistan with 10,000 enrollments. I'm sorry, it will not be possible for many of us, but still we can write a high quality systematic review, which would be actually even better than randomized control trial. So please train in how to write a systematic review and start publishing. It's going to give you a lot of dividends, citations, and prestige as well. And last but not least, this is my personal opinion to everyone who's involved in this process. Please do not launch new journals. Improve the existing one. Most of the journals that are being established in the last couple of years are affiliated with a particular medical universities. And the only aim is to allow the faculty member to publish their low quality research in order to fulfill the criteria and then climb the next step of academic promotion. That does not contribute to the overall research culture of Pakistan. So just to give you an example, in the last 15 years, the only medical university that has consistently produced the largest and the best number of medical articles in Pakistan is Agha University. That is a university that has the resources to establish a medical journal. They haven't done that. They invest in their people, they invest in their researchers, they invest in their faculty, and they help them produce and publish high quality articles in high quality journals. So you might want to do that as well. There are many resources for training and peer review. I'm going to give you the copy of presentation, so we'll not go in detail. Just want to tell you that the world has moved on and opened up for everyone. So please be proactive and start exploring these online resources so that you can also learn the art of peer review. Web of Science, Walter Kluwer, ACS Institute. This is one of the best, the Researcher Academy, and all of these courses are free of cost. They would not cost you even a single rupee. So Willy Inter Science, Master Peer Review by PRF. So there are so many resources available in order to help you become a better author and a peer reviewer. So the take-home message is, I'll start with sort of a request and what I feel should be the role of APPNA, considering that the amount of expertise you guys have, the amount of enthusiasm that you bring to the table. So you must support the research ecosystem of Pakistan. I know many of you are already doing that, but I would sort of like put forward some more suggestions. Number one, please increase the number of research seminars, webinars, and courses specifically geared toward research writing and bioethics training in Pakistan. And we know that everything can be done online. There's no need of like coming, and many of you do come. So please do contribute in this thing. Number two is formal mentorship. And this mentorship should not only be limited or restricted to undergraduate medical students. Many of us were not formally trained in research writing when we were students. So honestly, even as a faculty member, many of us are not very confident in research and writing. We also need mentorship. So please offer a formal mentorship for all cadres, may it be head of department or maybe a first year medical student. And because you people work in a better system, you have resources, you have vision, probably you can help your country in a much better way. We also need technical and academic support, obviously including language support. Poor English language is one of the top 10 reasons for which articles are rejected from international biomedical literature for authors based in developing countries like Pakistan. Our first language is not English. Many of our young colleagues, they conduct excellent kind of research, but unfortunately they cannot publish because they cannot write it in appropriate English language. Many members of APPNA have these kind of skills. Please help us out. And then depending on your skills, you might want to help us in research methodology, doing some research elective in the US and biostatistics. And please do some kind of collaborative research because you guys have the expertise, time, resources. People back home have a huge load of patient. So we can give you and provide you access to the patient that honestly you might never see in your life in USA, in UK, or other countries. But we still have those diseases, those disease pattern, and those issues that still need an answer. So please do some kind of collaborative research. And last but not the least, please do sponsor some training courses. maybe APCs, and some of the good quality research courses, and they cost some money. So instead of like, I'm not saying you dish out money, don't give that. Maybe you give out I mean, you can talk of the logistics, but you need to sponsor training courses for young enthusiastic students, resident and faculty members. And for everyone else, learning is your own responsibility, and you have to take your responsibility instead of blaming others or being jealous. Seeing somebody else's success as your failure is a cancerous way to live. So stop like blaming others. दुनिया सबके लिए ओपन है, दुनिया सबके लिए खुली है, और ये रिसोर्सेज सबके लिए अवेलेबल है. आगे बढ़िए, फायदा उठाइए और अपने आप को बेहतर कीजिए. And please remember, we rise by lifting others. Whatever we possess become of double value when we have the opportunity of sharing with others. If you share one piece of knowledge with someone else, it's going to come back to you in some form one day. That's a promise. And for the senior hierarchy faculty members, the illiterate of the 21st century will not be those who cannot read and write, but those who cannot learn, unlearn, and relearn. Medical science is improving, changing, transforming on a yearly or a daily basis. What we were taught 20 years back sometimes does not even hold true in 21st century. We have to unlearn and then relearn. I know it's a very difficult process for people like me and you, but we have to do that. And for the youngsters, Rona chhodiye, it doesn't matter how many resources you have. If you don't know how to use them, it will never be enough. We are a product of pre-Google and pre-internet era. Most of you even don't understand the challenges that we had once we did not have access to Google, Medline, PubMed online. Still we managed. आप लोगों के पास millions of free resources हैं. Please इनका फायदा उठाइए, अच्छी रिसर्च कीजिए, खुद आगे बढ़िए, लोगों को सपोर्ट कीजिए और इस मुल्क की बेहतरी के लिए कंट्रीब्यूट कीजिए. There are only two ways of spreading light: to be the candle or the mirror that reflects it. I thank you all for your patient listening. If there are any questions, comments, please let me know. I'll share my presentation, whosoever sends me an email, and you can go and explore my YouTube channel as well. I am done, Dr. Sadiq. Thank you very much.
Thank you very much, Dr. Rathore. So I think we are very limited with the time. So what we're going to do is I want to give 1 to 2 minutes for Dr. Murad Musa Khan to speak. And then we'll try to take on the questions that are mentioned in QA section. So Dr. Murad Musa Khan, if you can add your comments in just 1 to 2 minutes, and then I have a question for you about how to get published in an international journal. This question was asked by Dr. Fazal Wahid. He's assistant professor of ENT at Lady Reading Hospital, Peshawar.
Thank you very much, Dr. Naveed, and thank you, Dr. Farooq, for a very excellent presentation. I enjoyed it. You've covered most of the things that really need to be said for research in Pakistan. And I agree with almost everything you've said, except perhaps one point. There is something called academic colonialism or imperialism, whereby people from the Western countries come and access our patients, do studies, and then publish as first author, and then tag along a number of Pakistani authors behind that. The idea behind that may be noble, that you increase the research capacity, but it never happens. And our people only give access to the patient. So I will not agree with you there when you invite APPNA to come and do studies, because we have lots of pathology and lots of patients. I'll be very careful on that. The research agenda should always be set by the local people, because the problems may be global, but the solutions also has to be local. And for local problems, you have to conduct the studies locally. So I would agree with you there. And all the other things you've said about why do research, I would also add that you need to produce new knowledge, and you need to leave something for the next generation. When I started my research in suicide, I had only 2 small papers to go on. This is the pre-internet era. Internet was just coming around at that time, but I searched and searched, and I only found 2 studies. One was in 1965, and one was in 1981. That is all. And I was hampered completely. But now, if anyone wants to pick up the mantle of or get interested in suicide research, he or she will have scores of studies, if not hundreds of studies to build on. So I think that is very important for each one of us. One of the things that I would also like to point out, you talked about research ethics, I totally agree with you, but we also have to really contextualize that. Can you just focus on research ethics without improving ethics generally in an institution? And in all institutions that you talked about, the 184 medical colleges, there's no mention of ethics. So you cannot produce a culture of research ethics and just expect people to become ethical researchers, abiding by all the rules without a general improvement in the ethics in the whole institution, which includes clinical ethics, it includes organizational ethics, it includes ethics in teaching and everything else. So while you focus on research ethics, also people should also focus on improving the general culture. Students suffer from the lack of critical thinking because our education system, including in the medical college, is such that they're not taught to question seniors, question the unethical practices that are going on, the wrong practices. So in research, curiosity is the most important ingredient. You need to ask yourself what, why, when, where, and how. And unfortunately, we're not taught those things. So these are just some of the things I wanted to add to your excellent presentation. In answer to your question, Dr. Naveed, about how to publish in international journal, I think the way I started, I was very curious. I wanted to publish, but the way I started was really just writing general articles. Started with the school, college magazines, then writing for the newspaper, and then writing for local journals. And very soon I found out the local journals were really not of the standard or the quality or the reviewer system that I would be satisfied. So I started doing that. You start small, you may collaborate with others, and then you build on that, and then you start publishing. Yes, replication may be one way to start doing it. Someone has done maybe a study on certain things, case series in one country, you see if you can do it in your country. This is exactly what I did for my self-harm study, the very first study that I published. So you start small and then you build on that. But behind that, you've got to really read and read and read. For everything that you produce, you probably, for one study that you get published, you will probably have to read hundreds of articles. So start by reading as much as you can, inform yourself, educate yourself, go into it, look at what people have done, and look at the articles critically, what they've missed out. Why did they do this? Why not this thing? Where did they get this information? Go into the references. So first of all, read as much as you can. As you read, questions will be generated. Those questions will help you design your research questions, and then you start going and looking at what is available there. I will totally agree with Dr. Farooq that we have huge amount of pathology, huge amount of patients. Don't go for those randomized controlled trials. Go for naturalistic studies. People coming through your door, just study them. Just study their profile, gender differences, the background, the socioeconomic class, and so on. And case series, case reports, you start with that, and then you build on that. And eventually you will. I mean, international journals is not something that is beyond anyone's reach. Anyone can do that. But like I said, read as much as you can, then develop some questions, look what is available, and then try and answer those questions. And of course, like Dr. Farooq said, you must get trained in research. And if your institution doesn't do so, then there are different sources that you can and can access to train yourself in research. Thanks very much.
Thank you. And I think this is an really important discussion that is happening, and that's how we generate our shared perspective by sharing different opinions. Dr. Rathore, there is a question posted by a medical student, and I'm just going to ask you this question. And it is sort of person-specific question. We are currently dealing with, and you can also read that question, we are currently dealing with diabetic patient on a renal replacement therapy. It is a cross-sectional study. Our sample size is 60. Is that enough to make a mark? If you answer that, and then I'll ask the second section. You're muted, Dr. Rathore.
Sorry, give me a second. Can you hear me now?
G, yes.
Okay, so my first advice would be go and consult a biostatistician, because they are the expert in calculating sample size. And obviously the sample size is calculated by a certain formula. First of all, you determine or you select what kind of formula you are going to use. So in Pakistan, mostly I've seen people using that online WHO sample size calculator. There are certain parameters that you have to fill in. And once you fill in those parameters, and if the sample size comes out to be 60 and you can justify that 60 was the sample size that was appropriate to conduct this research, obviously any good biomedical journal is going to accept that. But in some cases, for example, if the disease is very, very common and your research is just an observational study, then the expert or the peer review or even the editor might say that, this disease is very prevalent. So yes, statistically, you have come up with a very small sample size, but clinically on ground, it does not mean anything. So that's why I always say, you need the input of an expert or maybe your faculty member, supervisor, that, you might have those technical skills, but the person at the top might have those real life skills. And he or she can tell you that whether these two things, this statistical thing and the real life clinical scenario, they do meet or not. So 60 might be an appropriate sample size depending on how do they present that, or it might not be an appropriate size if the disease is very common, or the peer review says, we need a larger sample size. So I would say go and consult a biostatistician.
And the second part of question was that, this student is working with two other students, and, one of the faculty might be an author on the paper, whether it would be disadvantaged to ERAS. So ERAS is an residency application software in US. It would not be disadvantaged, but again, we all need to consider or think about, the contribution of each author in a paper. I think that was the point that Dr. Rathore was trying to make earlier. Now, Dr. Syed Uzair, are you there? I see that you are muted, camera is off. So I'm gonna pose this question to you. I'm gonna go a little bit over time because it seems like people are interested. So Dr. Gul Nawaz Khan asked, I'm a trainee in family medicine. How shall I be able to become a quality and standard research writer? Please guide me, because we don't have such facility and training. And maybe Dr. Rathore, after Dr. Uzair, you can add on to this question. And Dr. Uzair, if you want to introduce yourself, I think that would be super helpful.
Yeah, so I'm basically Toronto based, and my specialty is healthcare management. So that's a little bit different from this thing, but I am part of this move since we started like 2 years ago. So as I was mentioning and writing, so we had a series of webinar on clinical research here on APPNA Merit, and many speakers, they presented a lot of stuff. So that's very important. Lot of free stuff, lot of training resources, lot of places. So I have mentioned the link to the YouTube channel where you can find all the materials. So it's a in detail overview and in detail submission about all the resources. So I think now with the internet and everything, so the resources and the money is not the question at all in these days. If you have a will, you can find all the stuff even at any level. So as mentioned by Dr. Farooq Azam, so it's a great presentation, and I think it's going to add a lot of value to the already existing resources which are available. So anyone can go to the website and have a look to all the free material for the undergraduate level. You just need to have a good internet connection. Now, knowledge is not the domain to anybody, or to the people who have a money. There's a huge repository, so we can share with all the participants a lot of resources, links. They are free and they are available to everyone. Thank you very much.
And thank you. Dr. Shahid Rafiq, I will come to you, and maybe to Dr. Rathore. There is also in nonprofit with name of Author Aid. They are doing a lot of writing courses. They are free of the cost, and they do an excellent job in writing courses, and in some other areas of research too. So you can certainly look at them and see if that is a possibility. Dr. Shahid Rafiq, did you want to add something?
Yeah, thank you, Sadiq. I think it was one of the best presentation in a long time that I have attended. Thank you, Dr. Rathore, for that. So one thing, being with APPNA Merit for a long time, we did, in the beginning, focused more on education, medical education, lectures, seminars, and then later on courses. But we started about, I think, 2-3 years ago, focused more on research. And that's why we created a subcommittee in APPNA Merit for research. And now I'm really happy that Dr. Sadiq Naveed is chairing that, and I'm very hopeful that he will find his own way. But I just wanted to highlight what Dr. Murad said, that I felt that there was a hint of saying that we really don't need international help, and we have to come up with an indigenous solution to the problem, which is totally fine, except that you sometimes have to see the track record. If the things are improving, if Dr. Rathore's presentation was about see how well we are doing in each and every aspect of research, then that's really good. Then you really don't need anybody. But if the state of affair is such as Dr. Rathore mentioned, then sometimes, collaborating, not asking for help, not asking for a hand, but collaborating would not be a bad idea. So I'll leave it up to Dr. Sadiq Naveed to find his way. You will see, Dr. Sadiq, that there will be some people who will be very welcoming in Pakistan, like Dr. Rathore, for your effort to improve conditions in research everywhere, including, so collaboration. And you will find some people who are not. So that's my one point. Second point to Dr. Rathore is that when you said about the incentive to research, other than, of course, getting residency or getting promotion, have you had any view or opinion about when you, especially with your rehab background, when you bring in some instrument or medical device that helps in rehab and develop a research around that, can that be an incentive? And what is your opinion about that?
Thank you very much. I think that would be absolutely a great incentive because, because of globalization, most of us know what is happening all around the world. But many times we do not have access to those kind of tools, those kind of machinery, and those kind of things that can actually maybe make a positive difference. And we would love to do research. So at least in rehab, yes, we are always open to collaboration. And I'm pretty sure for every specialty, there are certain things that we cannot arrange at our own in Pakistan. So if APPNA can sponsor or support and bring that particular tool here, and that would at one end provide clinical care, and on the other end, it would help generate clinical data, good quality local data that can be published in national, international biomedical journal. I think that would be an excellent win-win situation for everyone involved. And that just does, from my side, counts in an incentive. So thank you for the idea.
Thank you. I think, that, people in Pakistan knows about their situation the best. And I think we can share our perspective on how to make things better, but things needs to improve internally and we can just be a partner in their journey. So going back to, I think the question about resources, the courses that, I think I forgot the name of the person. Dr. Rathore, do you want to add to that point? What are some of the resources about research writing and all of that? So,
yeah. So thank you very much again. Going back. So again, I did my sort of medical school in late 90s. It was the time when email was just starting off in Pakistan, and we had a very patchy internet. So I tell my colleagues that in 2022, you have multiple resources available at your fingertips. Obviously, this is not the time for that, but just to quickly recap the resources. Again, one you mentioned, AuthorAid is an excellent free resource. It's a global database where more than 22,000 researchers from all around the world, they come together and try to help each other. So please go online, authoraid.info. Excellent resource. There are many free research writing courses available on Coursera and edX, again, free of cost. But if you want a certificate, you only have to pay $70 US. So what is better than getting trained in 8 weeks from a faculty of Harvard Medical College on research and writing for free? What else do you need? You don't even need to leave your institution, your even bedroom, and you can do that. Then researcheracademy.elsevier.com. So Elsevier in 2017, which means before 2017, this was not available. Elsevier, which is the largest publishing group of scientific literature in the world, launched a researcher academy specifically geared toward publication process of biomedical researchers. Researcheracademy.elsevier.com. It is an excellent resource which gives you a modular sort of training in research writing, and the training is led by published authors, editors, and peer review of the journals. Then this Web of Science by Cleverate, they have this again online academy free of cost where you can enroll and you can do all the courses. So in summary, if anyone is really interested in becoming a better researcher, a better clinician, honestly, a lack of resources is not an excuse in the 21st century. Most of you have smartphones, you have these handheld devices, you have internet connections, and you have laptops. So please go online and train yourself. आखिर में ना ट्रेनिंग की जिम्मेदारी अपने ऊपर बंदे पे आती है, याद रखिए प्लीज. दूसरों को ब्लेम करना, दूसरों पे इंहिसार करना कम कीजिए. Be self-sufficient and try to explore the resources that the world has actually put forward for your consumption. So there are a lot many resources. If you need more list, please email me. I'll share those resources with you as well. Thank you.
Thank you very much. And Dr. Rathore, if you can share those resources with us, and then we can share with people.
I'll do that.
And for systematic reviews and meta-analysis, Cochrane, if you go on Cochrane's website, it has modules on systematic reviews, and they are either very low in cost or free to people from middle and lower income countries.
Yes.
I would give a chance. So we'll take 2 more questions from the attendees, and then we'll wrap up this session. So Dr. Smayat had her hand raised. So I'm going to give her a chance to, Dr. Smayat Taslim, do you had a question, comment?
Yeah, thank you, APPNA, to arrange a very informative session. I have one concern, because a lot of researchers have lack of resources for paying publication fee. The publication fees of international high impact factor journal is so much high. One research groups and one Pakistani researcher have very difficulties to pay these fees. So can you arrange some research grant and some collaborative work collaboration to pay these research pieces, and we develop certain research groups to one researcher in Pakistan and multinational research group. It is the best research to publish to the in good impact factor journal. It is beneficial to everyone, the low income group and high income group.
So I think we got your question. So I think what you are asking about is, and Dr. Rathore can add, and then I can add too, is about publications in paper, article processing charges. That's what she's referring to. So can you add to that? And then I'll add my 2 cents on this.
Okay, so first thing is, many journals, yes, they are charging a lot of money, but then many journals, they offer substantial waivers to either students, residents, undergraduate, like students, and also even faculty member and people based in lower and lower middle income countries. So the first thing is you need to ask for a waiver and you need to apply. Or again, it connects to something else which is not like part of this, but again, I feel it's very important. And that is, we don't even know how to communicate. We don't even know how to put forward our case in form of a good application or a good email. So I personally know many students, colleagues who got a waiver of $1,500 and they published for free in international biomedical journals. That's the first thing. But I know, yes, in many cases, they only offer you like a 50% waiver if you're a faculty member. So that still makes like $500, which is a substantial amount. And then it connects to another point that I usually tell to my colleagues, that whenever you make a team of 5, 6, 7 people, you clearly tell them that this team is not only going to contribute in every aspect of research, data collection, writing, they are also going to contribute in finances. It's very difficult for one person to pay 75,000 rupees, but it's pretty manageable for a group of 6 people to contribute 12,000 rupees each. But this thing has to be clearly communicated right at the start. So if there's a will, there's always a way, and there's always solution to everything in life. You have to be pragmatic. You have to be sort of like a bit wise, and you have to act smart, and the solution will come to you. This is what I think. Yeah.
Yeah.
Over to you, Nabi Sadiq.
Gigi, thank you. So I have published over 100 papers. So maybe about 20 of them or 25 of them, they went to open access journals, which means that you have to pay for them. Many journals still offer subscription journals and hybrid. There are many journals are hybrid journals. So you can still publish in international journals without having to pay anything. And, you know, for open access, like Dr. Rathore was mentioning, they will either do a partial waiver or a full waiver. So I think that is possible, but the more I think the financial resources where are needed are on the data collection, you know, administering questionnaire and all those sites. I think article processing charges is a limitation, but not a big of that. I offered mic to Zoom user. It seems like, you know, he came on panelist, but then jump back to being attendee. So let's see. Let me bring him back. Just, you know, a question or comment in 15 seconds, and then we can wrap it up. Zoom user, and also try to use your name because, you know, it's better to connect with people with a name. Are you there? You can open your mic and speak. Okay. We'll give like 5-10 seconds. If not, then.
Sure.
Okay, so it seems like there is some difficulty. So I think with this, it has been an excellent session. And thank you, Dr. Rathore, for being part of it and presenting. Thank you, Dr. Murad Musa Khan, Dr. Syed Uzair, Dr. Shahid Rafiq for being as a part of the panelists. I think this is a journey, and, you know, we need to work and collaborate in this journey. I think there was a question about future activities on research and around research. So on Facebook, there is an APPNA Merit page. You can like that page. We will frequently share our upcoming events on there. There is also a Discord group by APPNA on Research that you can join that is currently being shared in the chat. And at the end, I really appreciate Waleed for organizing all of this, you know, connecting us. It was an excellent last 1 hour. Thank you very much. Have a good day, everyone. Thank you. Bye.
Thank you. Assalamu alaikum.